A lot of mental health problems are common everywhere. And everywhere where these problems exist, it's sort of a shocking reality that most people who have one of these problems don't get care at all. That is sort of a shock because these can be pretty serious problems, and almost all the time, if somebody gets the right therapy, they can have a good outcome. But for example, if you are depressed, you might not recognize that you're depressed, in part because the depression is keeping you from being aware of it. Or if your thinking isn't really very clear, it might be hard to realize that your thinking isn't very clear. So there's a first obstacle is just recognizing you have a problem. And then a second obstacle is finding where to go for help. And one of the reasons why I think your show is great is that it might convince somebody, maybe there is something about the way I'm feeling, and maybe I can get off the couch and go get help. So the biggest first problem in getting help is people just not knowing that they have a problem and not knowing that help is available. So that's true everywhere, and that's certainly true here in New York as well.
Okay. What other things stop people from getting help?
Well, sometimes if you jump through those first two hoops, or you jump over those hurdles of realizing that there's a problem and knowing where to go for help, there can be all kinds of other issues. Unfortunately, stigma keeps people from getting help. There are a lot of people who decide that I would rather suffer with this depression than risk the odds of somebody in my HR department finding out that I'm getting mental health treatment because it might affect my job status. Now, I think those attitudes are changing, and of course there are laws that would protect people from being discriminated against because they had this kind of a problem. But stigma can get in the way of seeking help. And then insurance coverage hasn't been very good for care of mental health problems for two reasons. One is that up until now, and then we've got this big healthcare reform bill, which we hope will change this in the future, but up until now, a lot of people's health insurance is just based on their job. And if your problem of depression or bipolar disorder or schizophrenia keeps you from holding down a good job, then you're not going to have any health insurance at all. So that can be obviously a problem. And also for a number of reasons that I think are largely not grounded in fact, some insurance companies haven't provided very good coverage for care of the brain as opposed to care of the rest of the body, which when you put it that way, sounds like it doesn't make any sense. And really it doesn't make any sense. But there have been additional hoops to jump through to get insurance coverage to work. But one of the good things about this healthcare reform effort is that the Congress has essentially said, we ought to take as good care of the brain as we take of the rest of the body. And it's not going to be a magic fix overnight, but I think over time it's going to be easier for people to get insurance, first of all, and second of all, to have that insurance pay for the care they need.
Talk Therapy Television is broadcast to nearly 1 million New York homes. Learn more about us or watch the show on demand at www.talktherapytv.org. Now also on Facebook and Twitter.